I want to talk about osteomas. Osteoma is basically a benign bony growth that's most commonly in the forehead zone. So you may feel this hard bump in your underneath your skin, but it's fixed to your forehead. So in other words, when you move it, it's not movable. It's just stuck to the bone underneath. Osteomas are actually quite common, and so sometimes you'll see people with quite a bit of deformity where they have this big circle sitting on their forehead, and it's something that bothers them, and you wonder, how the heck can I get rid of this? I don't want a scar on my face. Is it stuck to the bone? Is it impossible to get out? What can this doctor do? So I specialize in osteomas. I want to talk to you about how to remove it and how it's not as hard as you think it is. So what I try to do is I make an incision along the hairline, typically as small as I can, and I do what's called a trichophytic closure. A trichophytic closure means I intentionally cut through one row of hairs to allow the hairs to go through the scar. I do that for my facelifts. I do that for my harvesting for hair transplants. I do that for my incisions up here. So it allows the hairs to go through the scar. Because it's just an incision under no tension, since I'm not removing tissues up here, that closure is really, really favorable. And I hide it along the hairline as best as possible. I take that incision down subperiosteally, so the layers of the scalp are actually scalp, S-C-A-L-P. S is skin, C is cutaneous or subcutaneous fat, A is aponeurosis, that's the thing that you can see sliding here. L is the loose tissue, that's actually the tissue I'm sliding, and P is the periosteum. So that's the tight lining of the bone. I just undermine that very gently, it lifts up, and I visualize the osteoma. With the osteoma, I use rhinoplasty instruments and osteotome, which is basically a flat blade. I just tap it, and the osteoma comes off. It's really quite interesting and cool how we think that this osteoma is going to take all these burring and drilling. It doesn't. It just falls right off. Once I just tap it off the bone, it comes right off. At that point, I look. If there's a little irregularities, I'll do a little rasping just to make the edges smooth, and then I close the incision. I close it under a couple layers. I oftentimes like to pre-Botox the area a week or two before, if at all possible, or a day before. What that does is that it limits the stretch back on the scar to make the incision heal really well. I use dissolvable stitches, so if you're flying in from out of state, I can easily just do this and have you fly back out that day or the next day. Usually I like you to stay one night if possible, but you can fly back out. And the stitches dissolve, so it's easy, you don't have to do anything about it. And then oftentimes I'll also inject a little Botox into the incision, which further helps it. And Botox in the incision actually allows the scar to heal really, really well. So if you've got a weird bony bump on your forehead and you're wondering what the heck can I do to take this out, it's actually easier than you think. I've got a lot of experience in managing this. It's not that hard, but it's one of those things that you may wonder, what is this bony bump on my head? What is this weird thing that, how can I ever get rid of it? I feel so self-conscious. And fortunately, the removal is actually easier than you think.